Okay, so Dr. Uyilawa, your association says the government has been insincere in meeting with certain demands of your association. Can you help us understand how crucial these demands are, especially the demands for the welfare of the resident doctors?
On the 31st of January 2021, the National Executive Council held a meeting in Owerri. And part of the resolutions of the meetings were, one, that the House officers have not been paid for at least 6 to 7 months of salaries. A letter came out from the head of service saying that they are out of the scheme of service. That's one. We have members on a non-regular giftness platform that have not received salaries for 7 months. We have those we lost 19 people to resident doctors to COVID-19. And part of our resolutions prior to that time was that all health workers will be insured. But however, as it stands, no death in service insurance have been given to the next of kin for those we lost. You are aware that since the last time that the hazard allowance was negotiated was in 1991, and part of our resolutions were that a new hazard allowance to be given to all health workers. But as it stands now, over 114 days of today, nothing has been done about it. The Medical Resident Training Fund is a fund, that's an act that was put onto law in 2017. And part of the Medical Training Act is that the Medical Resident Fund will be given to all doctors in training wanting to be consultants. Part payments was made in 2020, September, December, and the other ones were neglected. Why those for 2021 was not even put into the budget? We met with the government on April 31st, or March 31st, and April 9th. And the memorandum of understanding was drawn with all parastatals involved and it was signed. But as of today, for 214 days after, most of what we asked for have not been assent to.
Okay, Dr. Uyilawa, you've stated so much the importance for the welfare of the doctors, and so far you said 114 days the federal government has yet to do anything concerning the memorandum of understanding signed between the resident doctors and the federal government. You also talked about COVID-19, and we would know that as much as affecting doctors, this strike is coming amid rising COVID-19 cases and detection of the Delta variant of the virus. As such, some might say perhaps this is not the best time for doctors to go on another strike since we have lots of strains of the virus in Nigeria. What's your response to this?
My response is simple. We lost 19 members to COVID-19. But you actually agree with me that even hunger is more worse than COVID-19. If you have members that have not been paid for 18 months, like in those in Abia State, Absut, you have members in Insut, in Imo State that have not been paid for 8 months. They are human beings like us. They have families they have to cater for, to get the basic necessities of feeding. They can't even afford to go their children going to school. With most of them, their children sent back home because the doctors have not paid their school fees. Now that because you're a doctor, you're able to tell the person on like you stay in his house that you're not able to afford your rent. Those are things that make you to be depressed.
Okay.
Because you are not able to measure up with your basic necessities.
In your own purview now, from updates you've gotten from other states, because this is a nationwide affair, what's the compliance level so far?
So far, there's 100% compliance with the strike. The difficulty of your members are having in Lut is not unusual because it's part of the places that are causing problems in the health sector. The Chief Medical Director, Professor Chris Bode, have been one of the people that have made us to go on this strike. Part of the reasons why we strike is the abolishment of bench fee, which has been 100% so far until it got to Lut. The Chief Medical Director of Lut has changed the name from bench fee to training fee, to the extent that people that have come as Supra to work there are being told to go and pay extra money. As of on the 9th of this month, was made to pay 300,000 naira for training for 1 year, that was abolished. Now, what it does now, the tax it does now, it tells them that it's not available, that it should go through the the CMAC, and prevents people from training because he wants to make everybody pay money.
Dr. Uyilawa, sorry to butt in here, but this question keeps on burning. What's the guarantee that the strike will have its desired impact? We've had, even previous from your predecessor, we've had strike going on from the resident doctors. Earlier this year, we had another strike. What's the assurance that this particular strike will have your desired impact?
The impact is simple. Because we are patriotic to Nigerians, that is why I must first apologize to Nigerians for the difficulties the strike will cause. But because of our patriotism, that's why we keep on shifting the goalposts in trying to deliver healthcare to Nigerians. But at this stage, not everybody is able to go abroad to seek for healthcare. As of me, I know I can't even go abroad to seek for any healthcare. So that is deficient from us.
Okay, as the federal government,
we tend to go all through.
Okay, as the federal government met with you in any way, has there been any word from the federal government concerning this strike?
As of the last 2 weeks, we've met with the Minister of Health, Minister of Labour, the deputy directors and PAMSEC, then people from Budget Office and the IP's office. We have not had any information from them yet, up to now as we speak.
So this strike will continue until your demands are met?
Yes, definitely.
All right. Thank you so much for joining us on the news and, of course, shedding so much light on this strike going on. Thank you so much for joining us on the news.
Thank you for your time.